Good evening and thanks so much for joining us for this update from your coronavirus headquarters. I'm Mike Thompson. In Wisconsin, 8,900 people have now tested positive for the coronavirus and 362 people have died. 4,300 people have recovered in the state. In our area right now, Wisconsin is meeting 2 of the 6 gating criteria established by the state's Department of Health Services for the Badger Bounce Back Plan. The state is showing a downward trend in flu-like illnesses and cases among healthcare workers. About 80 more cases are being reported per day in the state than just 1 week ago. While the university system plans for the fall, the UW Regents are set to vote this week on whether to scrap requirements that students submit ACT or SAT scores as part of their admission applications. The Regents are set to meet tomorrow to consider lifting the requirement at all institutions except UW-Madison for the 2020-21 and 21-22 academic years. System officials wrote in a memo to Regents that dropping the requirement will allow applicants to move ahead without being penalized for their inability to take the tests as testing agencies cancel appointments during the COVID-19 pandemic. Taking a look at the latest numbers in Minnesota now, there are more than 8,500 infections and 480 people have died. The 728 new cases reported just today is the largest one-day total in the pandemic. In some good news though, 5,000 people in the state no longer need to self-isolate. 1 new case is being reported in Winona County. There is nothing new to report for Houston County. The COVID-19 pandemic is projected to take a nearly $4 billion bite out of Minnesota's budget, swallowing up its rainy day fund. Budget officials now project a $2.4 billion deficit for the current 2-year budget. That compares with a projection just 9 weeks ago of a $1.5 billion surplus. Minnesota Governor Tim Walz says he's not ready to rule anything out, including layoffs and furloughs of state employees. Taking a look at the numbers in Iowa now, a 4th death is being reported in Allamakee County, and in the entire state, more than 10,000 people have tested positive. 219 people have died, and more than 3,800 have recovered. A medical clinic in our area is providing a type of testing to better understand the coronavirus. Provisions Health in Eau Claire is offering FDA-approved antibody testing for COVID-19. News 8 Now's Tyler Jobe explains how accurate the testing is and who it's available to.
Most coronavirus cases are mild. Few of them are severe. And sometimes we might not even know we've had it.
Everyone is thinking that maybe we already had this, that maybe this was here before we realized.
So about 2 weeks ago, Provisions Health in Eau Claire started conducting antibody testing to gain further knowledge about just how widespread the disease is. Testing is available to anyone.
And since then, we've done around 50 of them.
Antibody testing shows whether or not someone had COVID-19 in the past. Antibodies are designed to help fight off an infection, like the coronavirus. They are proteins made by our immune system in our blood. Provisions Health conducts the testing by drawing blood from your body and sends it over to their Florida lab for results.
It's above a 90% accuracy rate.
But Dr. Paul Moling of Mayo Clinic Health System says not all antibody tests fully work.
I know that there's a number of tests that are out there. Some have been called into question about their accuracy at this point. The government is trying to sort through that as we speak.
Jen Rumbalski, health director for La Crosse County Health Department, says the county is not widely conducting antibody tests right now. The county is instead using polymerase chain reaction testing, or PCR, for widespread screening.
Those types of tests are much more specific and much more accurate right now, and are the way to detect current infection.
Provisions Health CEO Gwen Sweeney says the clinic developed a return-to-work program that allows employers to test workers for the virus.
If they would like to do the actual COVID test and the antibody test and screenings for their employees before they come in or enter the building, we have a lot of different options throughout Wisconsin that we can offer to employers.
Slusher says results from the antibody tests can take up to 48 hours. In La Crosse, Tyler Jobe, News 8 Now.
Sweeney says the cost of an antibody test through Provisions Health is $195. Cost for businesses through the Return to Work program to run a test is at least $100. Well, thank you for joining us for this coronavirus update. We hope you can join us tonight at 10 o'clock. Take care.